Chapter 10. Muscles of the leg, ankle, and foot. To work the crural fascia, use the palm of your hand to glide over the tibia, superior and medial. You can also use a supported thumb. Another option is to use your elbow. The ankle retinaculum. This is a grouping of bands that wrap the ankle, holding the tendons in. To work these structures, use your thumbs to slowly glide up the anterior part of the ankle. Move laterally with each stroke. When you're working posterior to the lateral malleolus, just use one thumb. Now start again and work the medial aspect of the ankle. Move posterior with each glide. Reposition your hands so they're comfortable while you do this. End next to the Achilles tendon. The plantar fascia. Use your thumbs to glide up the bottom of the foot, starting on the medial side of the foot. Use a supported thumb and deep, slow pressure. You may want to place your client's ankle on a pillow or use a bolster if needed. With each new stroke, move a bit laterally and repeat. Another option is to use your knuckles. Tibialis anterior, attaching to the tibia and inferiorly to the underside of the foot on the cuneiform and first metatarsal. To strip this muscle, use your fingertips to glide superiorly just lateral to the tibia. You can also use a supported thumb. Another option is to use your palm. Extensor hallucis longus. This muscle attaches to the tibia and lies deep to the tibialis anterior. The inferior attachment is to the big toe. To stretch the muscle and tendon, slowly plantar flex the ankle and big toe. The peroneus longus, attaching superiorly to the fibula and top of the tibia and inferiorly to the underside of the foot to meet the tibialis anterior attachment. To compress this muscle, use your thumb to glide up the lateral aspect of the leg, following the tendon until you come to the muscle belly. Stop and search for tender spots. Hold and wait for a release. Continue working up the muscle. You should be right over the fibula. The extensor digitorum longus, attaching to the tibia and fibula and inferiorly to all the toes except the big toe. To work this muscle, use your thumb and glide up the lateral part of the leg. This muscle is just between the tibialis anterior and the peroneus longus, so your location is just lateral to the tibialis anterior and in front of or anterior to the peroneus longus. The popliteus, attaching proximally to the lateral femur and distally to the tibia. To compress this muscle, bring the client's leg up, get under the gastrocnemius, and feel for the edge of the tibia. Then apply pressure onto the posterior part of the tibia. Search for tender spots. Wait for a release. The soleus, attaching superiorly to the tibia and fibula and inferiorly to the calcaneus. Find the Achilles tendon. The soleus is exposed to about halfway up the leg. To compress the soleus, use your thumbs. Search for tender spots and wait for a release. To stretch the soleus, use your palm to dorsiflex the ankle. Hold and wait for a softening. Give the muscle the time it needs to relax and stretch. Be patient. The gastrocnemius, attaching superiorly to the femur and inferiorly to the calcaneus. To work the gastrocnemius and other deep calf muscles, place the feet off the table for comfort and glide up the leg with your palm. Your first stroke should glide up on the lateral portion of the leg. Now repeat and glide up the center of the leg. Now switch hands for comfort and glide up the medial aspect of the leg. This can also be done with the fingertips. Another option is to use a covered thumb. The quadratus plantae, attaching from the calcaneus to the flexor digitorum longus tendon. This muscle has two heads. To compress this muscle, use a supported thumb to work into the muscle. Search for tender spots and hold. Wait for a release. and continue. To stretch the many small toe flexor muscles, use your palm to gently extend the toes. Wait for a softening. Be patient and give the muscles time to release. The abductor hallucis, attaching proximally to the calcaneus and distally to the proximal phalanx of the big toe. To strip this muscle, use a covered thumb to glide from the base of the big toe down the muscle to its attachment on the calcaneus. Repeat this a few times and feel for a softening in the muscle. The interosseous muscles of the foot, attaching from the metatarsals into the proximal phalanx. To strip these muscles, find the metatarsals with your thumb, then press between them and glide towards the toe. Feel for the next group of bones and repeat. This technique can also be done standing at the feet and pulling towards yourself. Another option is to push upward between the spaces. To apply shuckling, with the foot in your lap, grasp the foot and twist it back and forth. This is a general technique to soften the intrinsic muscles of the foot. Now squeeze the foot with your two hands, sliding down the foot towards the toes. Finally, stand at the feet and pull each toe towards yourself.